All right, you're here with Kevin Hawk, Administrative Coordinator of Population Health Research Institute. We're going to be doing some quick interviews with staff and faculty. Please tune in now. Dissemination look like to you?
It's a great question, Kevin. I think dissemination just can take so many forms, and I think it's really about sharing the information where people are at. So whether that means a graphic novel, a cartoon, to a nerdy academic journal, to a video or a tweet, I think dissemination just has to be a real chameleon.
To me, it means really going to the community and telling people what we find. So making sure we're not staying with the ivory tower, but getting out and sharing our data.
Dissemination to me is about finding innovative ways to get your voice and your work heard. It's about the spread of information, obviously, but it's more about, I think, finding those special nuanced ways to get it to people that need to hear it, even if they didn't know that they needed to hear it. And it's about finding ways for them to understand it and be able to spread it further beyond themselves too. I think it's about accessibility and sort of streamlining just the information of all the bits of hard work that you've done, and having that information put out there to be actually of use and of value and communicated across different types of communities.
To me, dissemination is all about prioritizing the right audience and also picking the right way to engage. So picking the right materials, picking the right voice, picking the right space, and making sure that it aligns with the priorities of your stakeholders, and always putting them at the forefront of when you're thinking of not how do I get this information out there, but who do I give it to?
What does a true partnership look like to you?
So a true partnership to me means getting partners in the room at the beginning when you're starting to brainstorm and think about what you might do together. And then, really making sure there's shared power in terms of recognizing ideas that you move forward with, so that everybody has sort of shared power in that, in the approaches that you end up taking. And then really making sure that people, it's depending again who your partner is, that they're engaged throughout the process, and even through finding the results, interpreting whatever you find, and then disseminating that, and making sure you think about ways to actually put it into practice wherever that might be to improve health. I think from a true partnership piece, though, you're really looking at long-term relationships and not just one project. So how do you maintain those relationships and keep alignment with priorities over time? Takes time to do that, and it takes effort to meet with people where they're at and not always bring people to you. So I think there's a lot of pieces and parts to sort of just building alignment over time and collaboration over time, whether you have a project or not.
True partnership for me is from start to finish involving as many stakeholders from the community as possible, getting their input, including them as key members of the team, and working together to design the ideal project, analyze the results, and share it with the population.
Yeah, I think a true partnership, a good partnership, is where people really don't feel afraid to speak up, share their mind. They know that their opinion matters just as much as the person next to them, across from them. It doesn't matter the letters after their name, how much school they went to. We're all experts in our own arena, and so I think having a true partnership is really where you value everybody at the table in an equal way, and you let people be heard, and you put it into motion.
It should be 50-50. Everyone should be putting in 100% and meeting each other halfway.
In a true partnership, both parties are equally committed to a project. And in my eyes, I would like to think that it is about being consulted when any decision is about to be made. I would like to be consulted first, and also when a true partnership is being listened to, when decisions are being made, and also when transparency is also important when in a true partnership.
Empowering community. People know a lot about their neighborhoods, and it's really giving them the resources to do what they need to do.
I believe that the community should have more rec centers for adults. They should have some way of just getting time, at least time out of the day for just having adults to be able to use the rec centers here in Cleveland. Offer better times for like Zumba, cooking classes, to have a healthier family. And I would even think that adding classes, first time home buyers, a lot of people don't know how to go about that, and it would be nice to be able to help out the community in that way as well.
Ways to help build a healthy community, I kind of feel as if help our local schools conduct recycling drives and cleanups. I feel as if with doing that, it helps create a beautiful green space by planting trees, shrubs in the area can be picked up, and which will kind of be like a huge improvement. I would say ask local businesses to adapt a spot to take care of numerous of areas that may have been in a way depleted just over the years. And then just kind of help paint and fix up local playgrounds and equipment so then kids will actually have things to do in the summertime.
What is the number one health disparity you think needs to be addressed in Cleveland?
Unhealthy environment. I think air pollution, exposure. We know that air pollution really clusters in communities impacted by historic redlining, and that these communities face a disproportionate burden of exposure from multiple sources. I think fixing that is key to fixing a lot of the health disparities we see in these communities and making everyone feel healthier and live longer.
There is the maternal health rate that is steadily climbing. There's the food disparities within the inner city. There's the gun violence. There is so much more. There's issues within the foster care system that I'm currently dealing with. There's not just one disparity that I could just narrow down because there is so much work that still needs to be done. I feel like with this question, I think we all can go on and on for days just discussing. So I just can't narrow it down to one. I think we're here because there's so much work that still needs to be done in the community.
In partnership. I don't want to be the only one speaking. I want to be part of a collection so everyone knows what everyone else is saying.
Minority aspects, but specifically with the Asian community, of understand that, not a monolith. There's a lot of different cultures and different ways that I think different avenues to be explored with our own health. I'd like, that to be respected and understood, that you can't just put a blanket and say like, oh, this is the healthy option for everyone of Asian descent.
Being healthy, for me, being healthy means that everyone's able to do the things they want to do physically and mentally without major barriers, and able to have the quality of life that they aspire to.
What being healthy looks like to me is not having to explain myself when I go to the doctors. I would like to, as an African descent, when I go to the doctors, I don't have to explain to my doctors that me using shea butter as a home remedy or using ginger roots because that's what I grew up using, folklore, or I don't want to be judged by a doctor because that's what I'm used to using. I want my doctors to be able to understand me and meet me halfway. So I think cultural competency is important, and I would like my doctors to acknowledge that. And I think it would be nice for doctors to incorporate that in their practices. So being healthy means that we need medicines these days to incorporate that, to venture out and explore more out there and be able to meet patients halfway and understand why they're doing certain things in a way and figure things out for them, because patients are able to do things because that's how things have been done in the past, and understand them. So healthy could mean multiple ways, and we should be able to understand that.
How would you define health equity?
I think health equity is everyone receiving the ability to make their vision and meet their goals of their personal health and making sure that comes to fruition.
Health equity to me is about finding the key to everyone having their best health, like that individualized way that everyone has what they find to be their optimal health. And it's kind of about finding that, that right puzzle piece, that right key, and adjusting it, making the proper like tweaks to whatever, system that you're delivering, whatever it is. It's about finding that right measure, almost like when you're playing a song and you're trying to like, you're messing with the equalizer and you're like, how does this song sound the best? It's, is it the add a little more bass, a little more treble here? Like that's what it's like, but for a person's health.
What I do to promote my own mental health and restoration. At least once or twice a week, I take 45 minutes out the day to go to a quiet space and meditate. I also will some days read my scripture. I have some yoga stances that I do in addition to after the meditation or after reading my scripture. I get a chance to write down my intentions for the week or for the month or for the year, whatever, I'm feeling in that moment. And every night I make sure that I read my scripture. That keeps me grounded, that keeps me in a positive mind state. And I feel like I need to read that scripture just to have the motivation to continue on with my day.
Individually, I like to take walks, long walks. That helps me think as I walk, and preferably in nature. I think access to green space is important to nature to help restore mental health.
So I do go to the gym, and I don't just do a workout. I love lifting heavy weights because it just clears my mind. I'm not really thinking about my anxiety. I'm not really thinking about everything that's happened throughout the day. I am just trying to lift that weight. And it's an accomplishment when you get to, when you're able to do it. So I think that helps me a lot in meditating. It clears my mind. You stop thinking about everything for a moment. And, it helps me a lot with my mental health.